My name's Tania Bennett. I'm 43 years old and I recently had a partial knee replacement in August, so I'm probably about 2 months out. I visit the Deer Valley location on 75th Avenue and Deer Valley, and I see Doug. So I've always been active. I've grown up playing soccer, volleyball, and then most recently I took up tennis a few years ago. A little bit late in life, so probably not the best sport to pick up, but that is kind of what my injury started. I had 2 meniscus surgeries over the prior year, or over the few years. And so then that led to me being bone on bone and me needing to have to do a partial knee replacement on my right knee. I've been with Foothills about 4.5 years now, off and on, through different injuries or pains or anything. What I enjoy most is that the minute that you walk in the door, everybody seems to know your name. And literally, it's just such a personal attention, and Doug really listens to you, and I feel like he takes the time to get to know you and the level of activity that you prefer to go back to. So just walking and being pain-free isn't enough if he knows that, my goal is to get back to the tennis courts and play, my normal 5 to 6 times a week. So they get you there, and I feel everyone's vested into it. I feel, Doug texts me to follow up sometimes when he knows I'm not feeling good, or I'm first injured, or I know I can text him, kind of 911, something happened. But for the most part, I always feel, again, that everybody seems to know what's going on and to help you if you need help. But then, of course, Doug's always a text away or a phone call away, and he does the best he can to get me in when I know that I'm hurting. I definitely don't regret the partial knee replacement. I've come a long way. Doug has really helped me, with the range of motion and getting me back up and going. Just a little bit of hitch, with a wound that isn't closing properly, but now we're addressing that, and so we'll continue to modify a bit, and then continue on with obviously the goal to get me back playing tennis courts and being as active as I usually am, and working back out at fast on my normal routine also to continue strengthening and keep up the knee and the therapy. Besides learning, what to do here and how to properly do it, work on my balance, of course, continue to strengthen my legs and my core. He also had recommended, to continue with fast, so I do that as well as just my normal routine. I've been doing that probably for the last year, I would say, that way to try and prevent injuries. But then, of course, when I need tune-ups, I come to see Doug for some dry needling when necessary. I don't feel like I'm just a injured patient coming in here. I definitely feel that everyone's vested in getting you better, and then the minute that you finally graduate after you've been here for so long, it really feels like they're along with the journey with you also. Like, they're feeling your pain, and as soon as you get better, they're feeling, your success of being able to get back out there and go back to normal. So I definitely feel that personal attention. And then again, it just feels nice to come in here, and it feels just like you're coming to see friends and family instead of treatment. It's like my home away from home.